This was about my third day out here. We drove in that morning, met up at the gang box, went over our safety meeting.
First thing in the morning, we got what they call a pre-task. The foreman will read over the pre-task, tell them what they're going to do for today, and then the men sign off on it. They do that 3 times a day.
Everybody signed the sheet. We had suited up to go to work. Inspected the harness, checked everything out. Good to go.
I mean, we go through CSA training, which is forge training. We go through wall bridges training. We go through Midwest training.
The procedure is anytime you're above 6 feet, you've got to be 100% tied off.
You're setting the iron, it's the most dangerous aspect, they say, and you're only as good as your partner. You need your partner needs you. We call it a marriage. You're married up there in the air. We had a tree of joists, which is 5 joists strung up. We set one at a time.
And we were connected truss to truss with the joist.
The pieces came in backwards, so we were going to spin them.
We had a 6-foot choker that we put in the truss. The choker wasn't long enough. I took one too many steps and it pulled me off. It pulled me off. If I wasn't tied off, I wouldn't be here. They sent several lifts up to get me. My partner actually is the one that come across and got me first.
I immediately ran back to my basket and went and picked him up.
I sent out a call that we had an employee, what we call go in the hole.
They took my harness off. We put everything in the back of the general foreman's truck.
They took him onto the hospital, had him checked out, make sure that he had no injuries.
Once I heard the lanyard rip, it's got some stitching in it. Once I heard that rip, I knew everything was okay.
Everybody was going by the rules, and it ended up saving a life.
So it's definitely pretty important. If you're not tied off, you're not going to get another chance. Well, I told my mom and dad about it. My daughter and my son. They were glad I was tied off. By following the safety procedures that will save your life.
He's probably going to be more aware of where he's at on the steel, because now he's going to stop and think about it. That'll be with him the rest of his life.
Even if you are tied off, the right way, even the best hands out there can go in the hole. You never know what could happen.
Don't get in a hurry. Paycheck don't do you any good if you're dead.
Despite the many challenges and limitations that COVID-19 imposed on our nation and industry, the Safety and Health Department launched the District Council Safety Hour Lunch and Learn initiative throughout North America to engage local unions, contractors, general contractors, and project authorities on specific safety and health issues. These calls utilize Ring Central, a virtual meeting media that allows all parties to communicate effectively. These calls are informal and scheduled for only 1 hour during lunch times to allow all parties to share topics, make comments, or express concerns on specific issues within the jurisdiction of each district council. Although these calls are only 1 hour, they generate many follow-up letters, documents, and calls from the safety department to help resolve issues. There are no presentations, and the agenda is simple. What's on your mind? We want to hear from you on any safety or health issue. Each district council and impact region throughout North America encounters their own safety issues pertaining to regulatory requirements, project requirements, and other issues affecting our members and contractors. In 2020 and this year, the District Council Safety Hour, Lunch and Learn webcasts have been successful to discuss and resolve many safety issues that could have resulted in unnecessary disputes, project delays, and workplace incidents. Following are some of the topics addressed during previous webcasts throughout North America. Concerns for working beneath or near high voltage power lines, fall protection requirements for offloading trucks, misunderstandings regarding the multiple lift rigging procedure, responsibility for the stability of rebar columns, walls, and decks, and health hazard concerns pertaining to welding fumes, paint operations, asbestos, and lead. As the Impact Management Co-Chair, I want to encourage your participation in future District Council Safety Hour Lunch and Learn webcasts initiated by the Ironworkers Safety and Health Department. Take advantage of this 1 hour call to address any issues that could help increase safety performance for your company and ironworkers.
I'm Vicki O'Leary, Director of Diversity for Impact. I want to take a couple minutes to talk about the Ironworkers Impact Maternity Provision Policy, how it can be beneficial to both our contractors and members. The great thing about the program is that it is funded through current established contributions. There's no additional cost for either the contractor or the member. The program brings relief to our pregnant members by providing financial support that can help families retain their health insurance, ensuring the safety of both mother and baby during pregnancy, and allowing members to fully recover from delivery prior to returning to work. We have made the process as seamless as possible for members to apply. The claim form and program brochure can be found on Impact's website. Members who qualify are provided a maximum of $800 a week for 6 months prior to giving birth and 6 to 8 weeks after delivery. Prior to the establishment of the program, many ironworkers felt they couldn't be honest with their employer about their pregnancy out of concern for their employment and continued work hours during a time when they needed to maintain health insurance. This led to injuries and even miscarriages that left contractors vulnerable to possible liability. The program relieves contractors of these possible liabilities by allowing ironworkers to open up and be honest about their pregnancy without fear of losing their much needed health care coverage. The Ironworkers National Joint Apprenticeship and Training Committee invest heavily in training a skilled workforce. Maternity Provision Program helps our partner contractors retain their training dollars by creating safe and healthy alternative for ironworkers employees during their pregnancies and encourage the return to work following delivery. Since Impact handles program claims from start to finish, it does all that and takes the administrative burden off the contractors and local union. This isn't an insurance policy. This is a safety program. And just like other safety programs, it's designed to help out contractors and workers. It's just good business sense to have a program like ours. If you have questions, please contact Impact Diversity Department for more information.
Thank you for logging on to day 2 of the Virtual Impact Conference. We really appreciate it. We hope you're getting a lot of value. Before we move in to today's first presentation, we're going to do another survey question like we did yesterday. This one concerns healthcare. How much did your healthcare premiums increase last year, whether you're talking about your health and welfare benefit or if you're a contractor, your healthcare premiums to your employees? A, they declined. B, 1%. C, 3%. D, 5%. Or E, greater than 5%. And as you may have guessed, this tees up the presentation that follows the survey, by General Counsel to Impact, Frank Marco of Gregorio Marco. So we'll watch as the various answers come pouring into our system here. And we all know how incredibly important maintaining cost is, and the trades in the Chicagoland area, with the ironworkers, of course, participating, have come up with a very, very creative program to address these issues and provide better service to the members and the contractors. So you can see right here we've got 32%. Saw about a 3% increase. We had 11% that saw a decline, 25%, 1%, 12% reported a 5% increase, and a whopping 19% said greater than 5%. So that will teach or give some guidance to you guys to really pay attention to this next presentation by Frank. Thank you very much.
Good morning. I'm Frank Marco. I'm a partner in the law firm of Gregorio and Marco. I also serve as general counsel to the International Association of Ironworkers, as well as to the Impact Fund. I've been working with Taft-Hartley Health and Welfare Funds for over the past 20 years, and my partner, Greg Jose, will also be making this presentation with me. Greg?
Thank you, Frank. I'm Greg Jose, also at Gregorio and Marco here in Chicago. And I've been representing Taft-Hartley Welfare Funds for about the last 12 years, and specifically the Riggers Local 136 here in Chicago in the Ironworkers universe.
The reason why we're talking today about the essentials of healthcare clinics is we're trying to figure out a way to deliver better healthcare and also to bend the cost curve so that it's more favorable to our industry. The cost of medical care has been skyrocketing for my entire lifetime. And definitely since I've been representing Taft-Hartley plans. When I first started representing them, no one wanted to mandate any cost-cutting controls because times were good, the costs were not out of control, and so there were no mandates. After that, every plan that I've worked with at least started implementing mandates in order to save costs, whether it's mandatory generics, mandatory medical cost management review, or some sort of utilization controls in order to get a handle on the rising, skyrocketing costs. These costs have been well exceeding the cost of inflation, and they've also been something that's wreaked havoc with our health plans, where a lot of the raises that are going mainly to the health plan rather to the guys' wages, and also our country in general. We pay more in the United States for healthcare than any other country in the world, and we find that we're not really delivering better results. So one of the solutions that is being bandied about today are healthcare clinics. The idea of getting better healthcare results at a better price by improving primary care. Our health model has generally been fixated upon treating illnesses and paying our professionals, our doctors, our hospitals according to illnesses that they treat or exams that they undertake or tests that they perform, rather than just paying the individuals in the healthcare clinics or the hospitals based on keeping people well or solving one of the problems that might be facing the guy in terms of his health care. So that is why we're talking about the essentials of healthcare clinics today, is a way to start bending this cost curve in order to get better results at a better price. That's something that everybody's always looking for, but particularly in the field of healthcare nowadays. So the next slide that I have is deals with why develop health clinics to begin with. And as I mentioned, the very number one is just keeping participants healthy. We as fiduciaries that sit on healthcare boards, if we can keep our participants healthier than they were yesterday, we've done our job, we've fulfilled our fiduciary duties. Don't just treat the illnesses, but through better primary care, help keep that individual as well as his family healthy and happy. And the way to do that under these healthcare clinics is to attract more participants through better service. Make it convenient for them. A lot of people complain that if they set up a physical with their doctor. They get an appointment a month out, 2 months out. And we all know individuals that have experienced medical problems that can't get in to see a doctor within a short period of time. And you never know when that long period of time is just a little bit too long, depending on the healthcare needs of that individuals. So we try to make it easy, really easy, in order to get that medical appointment. This saves money by avoiding unnecessary emergency room visits, and it primarily increases the percentage of people who see a doctor. Our studies have found that the number of people who don't have a primary doctor, the number of construction workers in particular who don't have a primary doctor that they see on a regular basis, is upwards of 50%. Half the people just don't see a doctor. Not all of them are young 22-year-old guys. Many of them are middle-aged people that are starting to have some health worries, but they just don't like to go through the hassle in order to get bad news. And so they avoid it. Further information is that about half of those individuals, their whole family isn't regularly seeing a primary physician. So this is something that if we want to bend the cost curve and save any money in the healthcare field, we got to get to the early detection of potential diseases. An individual who goes see a doctor every year, the doctor is able to take his vital signs at that point, take his blood, and whenever anything changes from year to year, they can gradually track it and stop a disease in its tracks through early treatment, diet, exercise, small doses of medication, whatever it might take in order to keep that person healthy for a longer period of time is what they're trying to do. We also find that a lot of prescription drugs are not handled properly. About 50% of the people who are either given a script, they either don't fill that script, or they don't take it in accordance with the instructions. Either one of those two situations is a potential disaster. So if someone's in regular communication with their doctor concerning their prescription drugs, that's a lot better than leaving them on their own to let them know that they have to take one pill a day and one pill every other day, because they just don't do it. Or at least they just don't do it on a wide basis. Some people do it perfectly, half the people don't. And that's the half that we're trying to fix here. The first thing that I just want to bring everyone's attention is the ownership options. How are you going to build these clinics? Most plans that are out there have, let's say, less than 1,000 participants, and they don't have the wherewithal to start building all these clinics that they're going to need in order to serve their membership base on their own. Even a large fund that might have 3,000 to 4,000 members, that large fund would not be able to set up a clinic in each different location that they're going to need to serve the vast majority of their membership. They might have enough to fill 2 different suburbs or 2 different counties that in their area the members tend to live, but they're not going to be able to reach as many people as you want to. You want to be able to serve a majority of your participants, hopefully even a vast majority of your participants. If you're only catering to one group that lives in one county, the other participants are going to resent it and wonder why they're paying extra in order to only serve health clinics in a given segment. Now, some people live far out. You're not going to have a clinic when there's only 5 people that live in a town. But the more you partner up with other funds, other like-minded funds, people that you know that also have a fund about your size, that also can't do it on their own, if you get 3 or 4 of those funds together, then your ability to start building clinics that meets the needs of all your membership is drastically increasing. If you could afford to have 2 clinics on your own, you could probably get 5 clinics if you partner with just 3 other funds of your size. Cost is always a factor. Spread the risk and increase participation by partnering with other funds. If you can't do that, and you got to do it on your own, and you're a large enough fund where you're going to do it, you're going to find that you're going to be missing some segments of your population, and at some point you're not going to want to do that. So at least explore that possibility. Rivalries shouldn't matter. Whether the other trade is a rival of yours or they do your work in the field isn't a primary concern. Greg and I, when we go to a doctor, we don't care who that doctor saw right before we got in or right after. It could be a management lawyer for all we know. They don't tell us, and it doesn't really matter. The key is to kind of keep your costs down and allow the majority of your members to have access to these type of clinics. And Greg, you worked with one of our funds, and we're kind of developing that there's a couple different options that you can have in terms of clinic models. If you could go into that a little bit for us.
Yeah, thank you, Frank. Another one of our clients, the plumbers here in Chicago, have their own wellness center, and they have seen great outcomes and a lot of great participation from their membership and their participants. And they've taken the closed approach. This is where the fund itself owns and controls the single wellness center. Of course, they're paying for all the overhead and they're taking all the risk. But at the same time, they get to control all of the services and all of the service levels that go along with the wellness center. And that's been very important to them. We're no longer looking at sort of a cattle call type of medicine. We're looking to take care of the whole person, spending 30 to 45 minutes with the participant to get a holistic view of their lifestyle and the needs that they have moving forward, to try to take care of any symptoms that they might have, any conditions they might have, and prevent additional conditions from coming up in the future. Now, this also gives them the ability to expand if they want to, and they have 17 counties here in the Northern Illinois area that they would like to see covered. And that's where some of the partnering options that Frank talked about earlier have come in. Another approach is a more open approach, and we've seen different providers make this an option. For example, Marathon is partnering with Ulico and offering an opportunity to get involved in a network where the construction costs would not be borne by the welfare fund or welfare funds, but they still have the opportunity to take part in all of the different wellness center locations that might end up being built throughout the area. And this is attractive because it's lower cost. You don't have the sunk cost of the construction, but you'd still have the access to maybe not just one, maybe 3, 4, or 5 locations. And the downside to this is that you could end up with less responsiveness because you have more funds involved, and Marathon and Ulico would be operating the centers with regard to all of the potential funds that are involved. You don't have the same level of responsiveness. You can't necessarily pick up a phone and demand one change as a result of something that you've seen with one of your participants and expect that it gets done, because the contract isn't simply with you, it's with a large number of funds.
You mentioned your experience with the plumbers, and you've been spearheading their efforts to develop clinics in the Chicago region. And I believe that we started with a closed approach and also with just the plumbers building it on their own. And then as the need arose and they wanted to expand more, that's when the kind of a coalition coalesced around those notions.
Absolutely. And we've stayed with the closed approach, but we have expanded to a number of different funds in the area, including Local 63 and Local 136, that are involved in bringing more and more participants together. And these locals are going through the process now of hiring a vendor to run their closed network, and are looking at as many as 5 locations to start out here in the Chicago area. And we've done a nice job of bringing everybody together and working together as really a consensus model to make decisions on the services that'll be offered and try to keep everybody healthier in the construction trades moving forward.
So now it looks like you're going to be able to have 5 locations throughout the Chicago metropolitan area. And prior to opening it up to other trade unions and their funds, how many did we think that the plumbers alone could have?
They could have supported maybe 1 other location, possibly 2, depending on the size. But their participant level was strong enough to support maybe 2. That would have been enough to put probably 40% of their participants within a 30 to 40 minute drive of a location. Going together with these other funds, including 63 and 136, with 5 different locations, they're going to see almost 70% of their participants within a 30-minute drive of one of the locations.
And that's why even if you're a large fund and you're able to put up some of these clinics, you're better partnering with other like-minded funds in order to increase the participation and the reach to all of your membership and all of your participants, or at least as many as 70%.
Fiduciary duty, as we all know, is all about process. You have to be able to document that you engaged experts and that you relied upon them in making the determination to open a healthcare clinic or multiple clinics, partner with other funds, whatever decision you might be making with regard to your fund. The first step in this particular case is engaging a healthcare consultant. You want someone who has a healthcare background and who has set up clinics in the past. This gives you an opportunity to lean on them as you are working to engage a healthcare clinic manager who's actually going to do the day-to-day operating. They will go about the process of hiring the nurses, hiring the medical assistants, and handling all of the day-to-day purchasing and all of the medical care that goes on. They'll also work with you very closely to hire the actual doctor that'll be working in your facility. The hiring process for the doctor is key. You want to make sure that you have someone that fits in well with your population. And if you don't get the right doctor, it can really submarine the success of the healthcare clinic long term. Once you've got those pieces in place, you want to decide on the size and the location of the clinics. Now, of course, you want to get as much utilization as possible, which means you need to locate them as close to your population as possible. You think about where fast food restaurants are; they're not we're in sparsely populated areas. They're where the people are, because you need to make it convenient. We're trying to get people who either don't see the doctor as regularly as they should, or folks that do, and try to capture cost savings along the way. And if we don't have them in the clinic, we never will be able to do that. You need to negotiate a lease, of course, for whatever space that you're going to take over. I would strongly recommend that you actually do lease a space as opposed to build it yourself. That's going to lead to lower costs long term. And you don't have to worry about all of the potential delays that come in with construction there. If you do need to build out your location, of course, you have to go through the competitive bid process for your general contractor. Of course, all of you will be very familiar with that sort of process.
For utilization being the key and selecting these locations, how far of a reach are your members willing to go in order to go to a clinic? What is your information in that regard?
So we've set a target of a 30-minute drive. We're trying to get it closer to 20 once the new centers come online, and potentially even more after we get this first round of a network up and running. But right now, 30 minutes is our target drive time. Now that works for us in terms of the Chicago metro area and what we expect traffic to look like and things of that nature. But the closer you put it to people, the better. So when we're picking the 30-minute drive time, we're trying to put it in a location where there's a very high concentration of trades members. And we've looked at all of the demographic data to pick 5 locations that make the most sense for the entire population.
And the healthcare consultant, they work with you on that. They take all the funds, addresses for all their participants and create what they call as a heat map that puts a little dot in every single spot that a participant is.
Exactly. We've gotten all of the demographic data from each of the funds that are involved and plotted them on the map of the Chicagoland area and selected the locations that made the most sense. So other legal considerations, if you are going the route of a coalition, you need to map out how exactly you're going to share costs. Initially, as you're getting the clinics up and running, it's probably going to be best to do that on a per capita basis. That's what we're doing here in Chicago, and then transitioning it to a utilization model. One of the keys for the Department of Labor will be to make sure that eventually the funds are paying for what they're getting and not anything more. And that will take an audit process, and you can lean on your professionals for that. But it is important that you get to a place where utilization drives the cost. Of course, you're going to need plan amendments and potentially a trust amendment if your trust document does not provide for the establishment of clinics of this nature. We've also run into some concerns with regard to what's referred to as a MIWA, or a multiple employer welfare arrangement. The Taft-Hartley funds that we all represent do not fall into that category under ERISA because they're collectively bargained. So the way we've gotten around some of these concerns that have to do with whether or not we're going to see state law regulation on the coalition, what we want to do is hardwire that into the collective bargaining agreement. So if you have an addendum to the collective bargaining agreement that from the bargaining parties that lays out the authority of the trust fund to create the coalition and then create the clinics that the coalition will operate, that should take care of any of your concerns. And finally, you want to determine what the plan amendments are that you're going to need and how you might charge your participants. Thus far, we've made the determination among the coalition that the plans will offer all of these services deductible free and copay free. The idea being if it's free, the participants are more likely to take advantage of it. But of course, that's a determination best left to your board of trustees.
And Greg, just discussing a little bit more on the legal agreement governing coalition costs and controls. If one fund has 5,000 participants and another has 500 and another has 2,000, how do you fairly distribute the cost? And also, if you're going to have 5 different clinics in a given region, but one of the locals, let's say all their population is really kind of dedicated in one of these counties, not spread out evenly like the larger ones may be. How have you developed a cost sharing method that everybody believes to be fair?
So our initial cost share method is based entirely on the number of participants that you have in your fund. Right now, we have 5 funds that are involved in our coalition, and each fund we have one fund that's approximately 50% of the population and the others in other smaller proportions. And we have determined to share costs, sort of the administrative costs on a per capita basis. So that's your legal costs, any auditing costs to begin with, and the cost of our healthcare consultant. After that, once we have the locations up and running for the first 2 years, we will bill each fund for the operation of those locations, as well as any of the construction costs, the lease costs, and any other administrative costs that come along with it on that per capita basis, while we determine how many people from each fund are going to end up going to each one of the locations. Once we have that utilization data, which our auditor will come in and determine what the proportions are for each specific location. And at that point, we'll transition after about 2 years into a utilization model so that each one of the locations will be billed differently to the funds based on how many of their participants actually use that particular clinic location. So you might see Local 63, for example, be very high in one location and very low in another location. And we think that's the most fair way to administer the coalition long term.
And then how does democracy work in a coalition like this? Would each fund have one vote if you have 5 funds that are part of this coalition? Or does it get weighted according to the number of participants or the number of money expended by each different fund?
The way we've designed it so far is to have everybody have one vote. So there's one management and one labor representative from each of the 5 funds, and everyone has an equal say. It's been very important from the coalition members from the very beginning that we all be treated as equals. We saw another set of funds try to go down this road, and some of the larger locals were not willing to give up that sort of power, that sort of equality. And it really harmed their chances of making this work. So we think the equal say and equal vote is very important long term to making this a successful venture.
It sounds like one of the most important parts is the clinic manager. That's really the one who's getting involved with selecting the doctors, the nurses, the receptionist staff. How do you go through selecting the clinic manager?
Well, the first thing you have to do is run a competitive bid process. There are several providers out there nationwide such as Cerner, who operates the Plumbers 130 clinic here outside of Chicago. There's also Marathon, whom I mentioned earlier, that's partnered up with Ulico. And then Premise is another strong national company that we'll be hearing from in our RFP process. There are other more regional players as well, and they're going to vary depending on where exactly in the country you are, but there are many different companies out there to hear from. Once you run that process and you get comfortable with who it is that's going to be running your operation, you have to, of course, make sure that you are protecting your participants. You need to make sure that they have strong HIPAA compliance measures. You have to keep the contract in a reasonable term. Of course, ERISA requires that. We are recommending you keep it in the 3 to 5 year window. You need to determine whether the ownership of the clinic is going to be yours. Each one of these companies is going to, of course, have an interest in keeping it as close to the vest as possible, and trying to make sure that you don't steal their employees down the road if you decide to move to a different vendor. Hopefully that won't be the case. But you'll have to deal with those non-compete and anti-solicitation clauses if we do end up in that situation. You'll want to work very closely with the clinic manager to ensure that all the expenses are taken care of. You want to understand exactly how all of the prescriptions that might be offered for free at the clinic will be handled. All of the different furniture, who's going to bear that expense? Is that part of the lease? Taking care of all of the staff and any turnover that might take place there as well. One of the things that you also have to consider is, do you have just one location, or do you envision having additional locations in the future? I'm sure the clinic operator will be very interested in working with you to open up additional locations in the future, and that exclusivity to that provider will give them a great incentive to continue working with you and work very closely. You also want to make sure that you have all the required insurance, and I would push a lot of this, and as much of it as possible, onto the clinic provider themselves. You want to make sure that you have property insurance against any liability there, cyber liability insurance, malpractice insurance, which will, of course, be the responsibility of the doctor in any medical practice that you contract with, workers' compensation insurance, and officers and directors' liability insurance. These are all a very key part of making sure that we're compliant with our fiduciary obligations.
So everyone in the clinic, all the employees, that they will be working for this clinic manager and not for the individual Taft-Hartley fund. Is that correct?
That's right. That's I think the best way to make sure that you're limiting the risk on the fund and making sure that your clinic operator is a true partner. At the same time, you want to have input into who you're selecting, especially with regard to the doctor. In Illinois, the doctor cannot work directly for the clinic operator, in this case, Cerner. But you want to check state law on how professional corporations can interact and physicians can interact with larger corporations.
What type of services are generally offered, or what type do you think are efficiently offered by healthcare clinics?
So the primary service is going to be primary care. This is sort of your general doctor that you think of when you go to get your annual physical. If you come down with the flu or a sinus infection, that sort of thing, this is the doctor that you would call. And that's where you really want folks to adopt your wellness center, your healthcare clinic, because that's where you can capture the savings, especially with people who typically do not go to the doctor and have a primary care physician selected. Of course, you're going to have a nurse along with that. Physical therapy is a piece that we've found to be very important. Having a place that the members can go to rehab from various injuries. And of course, in the construction trades, you're going to see a lot of shoulders and elbows, knees, hips that are going to need some care along the way. And having a place that belongs to them has been very important. And that's a service that we've seen utilized greatly. We've also seen a pretty high demand for optometry. And there have actually been a couple of cases where folks have had a piece of metal fly into their eye, things of that nature. And we've had great quick care, and we've seen folks have their sight saved as a result of the care provided at this particular wellness center. You also want to work with the clinic provider with regard to pharmaceuticals. There are a certain number of generic drugs that they can provide at no cost or very low cost that will make things much easier for your participant and hopefully avoid some of the trend of not filling prescriptions that Frank mentioned earlier.
Part of this is the convenience in order to attract people. So if somebody wants to get an appointment with their doctor, what's the expected wait time or lag time before they can actually get in?
Well, there's usually not much of a time at all. If it takes more than a day or two, that's often very surprising. And once we get a participant in the door, the wait time is less than 4 minutes on average at the Plumbers Welfare Wellness Center, and that's the level of service that we're expecting coalition-wide as we continue to build out in the Chicagoland area. It is very important that we treat participants, and their time is very important, so that we provide great service and get them coming back, and that word of mouth continues to travel throughout the participant universe to bring more folks into the wellness centers.
And in the world of iron workers, an individual could be working straight for 3 months and then get laid off on a Tuesday. So he would be able to get in that week if he calls in for an appointment on a Wednesday, typically.
Absolutely.
Okay. And then, so if he's trying to get an appointment and his appointment's in 3 weeks, but he's got another job starting, that becomes more difficult for that individual. They tend to just blow off the appointment rather than blow off the job. They need the money to support their families, and they can always postpone their health care to some later date. And that's what we're trying to avoid by getting everybody to get in there when it's convenient for them, without any cost to them. So they don't have to worry about how much money they got in the bank, or if they were laid off, they're not going to have to put some out of pocket into the doctor's office. So they could go in there, get checked out. How about prescription drugs? Would the doctor be able to prescribe some prescription drugs and have it filled at that clinic?
That's certainly what we're looking for as part of our coalition. We have a certain number of them at the Plumbers Clinic, and the ironworkers locals that have been involved in the coalition have been very interested in that. So we want to make sure that that's part of all of the different centers that we're opening, and try to expand it as much as possible. We're trying to limit it just enough to make sure that it doesn't trigger any concern with regard to our pharmacy benefit managers. Thus far, they have not had an issue with the number of prescriptions that are available, which is about 50 to 55. And we're trying to expand that as much as we can.
All right. And then are there any ideas about expanding some of these services in clinics?
We've actually had some of our coalition partners talk about dental. And we think there might be a place for that, but our motto thus far has been, let's walk before we run. So we're sticking with primary care services, physical therapy, and optometry, and of course the limited pharmacy benefit. But we have considered dental, and if there's enough demand out there for another service, the coalition is definitely open to that.
Perhaps the most important, or equally important, is the cost curve. So we talked earlier about this. The goal of this is to not only get better results, but kind of either shrink the increase in medical care or even decrease it at some point. If you can go through some of these examples of how we're trying to bend the cost curve through the use of these clinics.
The keys on bending the cost curve are really a couple of things that Frank talked about earlier. Avoiding unnecessary emergency room visits. The more you can keep your participants out of the ER, obviously, the better off your fund is, both from a monetary perspective and from a healthcare perspective. The ER is really going to stabilize somebody and then send them back out the door. And that's not the approach that we're looking for here. If we can detect illnesses early on, detect chronic conditions early on, maybe prevent someone from developing diabetes or a heart condition or high cholesterol, all the better. We can save money long-term by spending just a little bit up front. Eliminating the profit motive is a big one. And this really goes hand in hand with providing better service. This is all about keeping your participants healthier, keeping your workforce healthier. If they have fewer injuries and fewer illnesses, they're going to be on the job and getting their job done, and they're going to be much happier while they're doing it. You don't have to worry as much about the insurance overhead. You're paying for the clinic and all of its staff, whether you've got 5 appointments or 25 appointments filled in a day. So let's get the 25 appointments. And again, the biggest key is capturing those participants who don't have a primary care physician. If we can get them in the door and detect those detect early on any illnesses or injuries, that's where you can really capture the savings long term and see medical inflation for your fund drop.
The fiduciary duty of plan trustees is to administer these plans for the exclusive benefit of the participants, and that includes defraying reasonable costs. Whenever you're approaching a topic such as this, where you're trying to change the way that you're delivering medical care, take your time, be deliberate, do RFPs whenever you're hiring a professional, because you want to know what's out there, and you don't necessarily know what's out there. And your trade partners that you're familiar with, they also might not have been in this spot either. So do your RFPs, meet with them, consult with them, and document your decisions everywhere along the way, because these decisions are important, and they're also going to be lasting, particularly if you have a coalition. Each person is going to remember different things differently. So document the decisions that you made and why you made it. Establishing a health clinic is a way to provide these benefits, minimize costs, but take the time, get the right information so that you can make the right decision as a trustee, and then hopefully we can all get the right results at the end of the day. So I thank you for your time, and Greg, thank you. That's it for us.
I'm Vicki O'Leary, Director of Diversity for Impact, here to talk to you about some of the great work our department is doing to address harassment, bias, and other diversity issues in the construction industry. Our Be That One Guy program is an example of how current impact contributions are being used to benefit partner contractors, local unions, and ironworker members. Be That One Guy delves deep into the unconscious bias, harassment, and bullying that permeates so much of the construction industry. It gives members useful tools that empowers them to stop the issue before it becomes a legal issue for contractors or a treatment issue for workers. We also work in conflict resolution. Issues can arise with harassment, racism, gender bias, or any other myriad concerns that impacts a diversified workforce. Our department works with contractors, local unions, and membership to make recommendations for an equitable resolution for all parties. The diversity department is constantly looking for new avenues to promote our programs and educate potential partners and the general public on the issues Impact and the Ironworkers Union have identified. Through engagement with various media outlets, we educate and motivate allies within the construction industry. We work hard to build support for the changes we know are needed to sustain and retain a more diversified workforce.
Great information. A word about Q&A. We mentioned this yesterday, but just in case you missed it, ask your questions through the Q&A button. We realize we're not able to answer them on the fly here, but we will download all those questions and respond to all of them. So keep the questions flowing and you'll get the answer. So now we're going to move on to another survey question. And it has to do with diversity. You just saw Vicki O'Leary on our diversity program bumper video. Do you feel you have enough diversity in your organization? It's a hot button issue, clearly, in our society. So A is yes, B is no, and C, I don't know. So thank you for getting on and responding. We're getting loaded with response. We've got very good participation, and we really appreciate you logging on again today. And we look forward to being in San Francisco next year. And it's about a 50-50. 44% say yes, 46% say no, and about 10% says, I don't know. So tune in for this next very, very informative panel led by Scott Blair, the managing editor of Engineering News Record.
Welcome to our panel discussion today on why diversity pays for the Ironworkers Impact Virtual Conference. My name is Scott Blair, and I'm managing editor with Engineering News Record, and I'm glad to have you all here with me today. Wanted to start out with Ariane Begovish, who is a senior research fellow with the Institute of Women's Policy Research. Ariane, could you please tell us and outline the business case on why does diversity and inclusion matter to the construction industry?
Forgive me for starting with a very much a business school little chart here on the business case for diversity, equity, and inclusion. The reason I put this up is just to show that diversity and inclusion can impact everything, from recruitment to reputation to compliance. So the other issue probably is it can affect it in a positive way. It can benefit, but also more often you figure out that it costs you dearly when you have messed up on something. So just to start a little bit with recruitment, we know that the trades are getting to a point where a lot of skilled workers are close to retirement. So getting the next generation of workers in is very important. But we also know that you are competing with a lot of other industries that seem more exciting. So getting the right workers and not letting go of them once you have them is pretty important. A few years ago, I had the privilege of interviewing Bill Brown, the co-chair of Impact, around a really innovative work that the ironworkers are doing. They're the only building trades union who have a national pre-apprenticeship program targeted at getting in women. And what he said why they're doing is it's the right thing. We don't have enough women in the industry, but also we want to make sure that we kind of keep hold of anybody that we ever get in touch with, and that we are the ones who get the women who think this is the right career for them. And this takes me to the next point, retention. You probably all know the figure, $32,000 to get an apprentice through the apprenticeship as a journey worker, journey level iron worker. So if somebody leaves, you lose those $32,000. But what's often not counted, you have to pay more overtime because now you don't have enough workers. You have to spend a lot of time to find new workers and get them into the program. And of course, you may be fined because you don't finish contracts on time. So there are lots of costs or benefits that aren't really measured, but they can really mount up. Let's go health and safety. I don't want to put women as the superwoman or heroes. Women aren't necessarily more careful or caring or more concerned with health and safety, but there is quite a bit of research that shows when women enter male-dominated fields such as ironwork, they're more careful with tools, they're more concerned about ensuring that people stay healthy, and it means your health and safety compliance and tool compliance costs go down. But maybe the most important issue in this time post-COVID is reputation. The COVID epidemic has made the inequities in the labor market in our society very clear, and there's a very high appetite for change. And as Bill Brown said already, when this was 2017, way before now, we are relying in the ironworker industry on public and private large developers and funders. And they are under pressure, they want to see diverse workforces. So if the workforce that builds the kind of public and private contracts doesn't look as the general population, it is much less likely that there will be the willingness and the funds to finance that new work. So with that, I pass back to Blair.
Mary Vogel, you're Executive Director of Building Pathways, and I was very interested to hear about your integrated supply and demand program. Could you talk a little bit about that and how it furthers the diversity and inclusion goals?
Sure, thanks, Scott. Glad to be here today. In Massachusetts, we have adopted this integrated supply demand strategy to approaching diversity in our industry. And what that means is on the supply side, making sure we have pipeline opportunities to get more women and people of color into the trades. So we have 5 building trades pre-apprenticeship programs across the state, including ours in Boston, which is the largest one and the oldest one. We work with the career tech ed programs to make sure that we're educating their female students about career opportunities in the union building trades. It always surprises us that, you know, they're in a construction related track in their CTE program and know nothing about union apprenticeship or how to get into an apprenticeship program. So we offer conferences where we educate both the students and their advisors and educators about union apprenticeship. We also launched what we call a Build a Life campaign in Massachusetts. And that's a campaign where we're heightening the visibility of tradeswomen so that other women who are not in this industry, but would like to explore the opportunities, see that women are actually occupying these positions. And we do that with media. We hold monthly Tradeswomen Tuesdays where we invite career seekers to hear from tradeswomen who are doing this work about their experience in the industry. We had one of those last night with 40 attendees. So we know women are interested in these careers. On the demand side, we want to make sure that once we bring these women into the pipeline, there are opportunities for them to start work and continue to work and make a career out of this industry. And in that regard, we're working on the public policy side, making sure that the state and local hiring goals for women and people of color in these construction trades positions are actually being implemented through compliance, as well as best practices, sharing best practices with contractors and the unions about how to meet these goals. And that leads me to the role of, you know, subcontractors and unions in creating more diversity in their membership and in their workforce. One thing that we really focus on from the contractor's perspective is to make sure your core crew, those people who are with your company from job to job, is diverse from the outset. When you go to a project, you should make sure your initial workforce there is diverse, that it has women and people of color, because it's your core crew. It's that opportunity where you can really build a strong skill set to make it a career in the industry. We tell contractors, don't checkerboard. What that means is moving people from job site to job site just to meet hiring goals. We don't want that to happen because, again, they're not building their skill set. We want contractors to track their diverse workers, to make projections about what their workforce needs are, and then to track the diversity. We're hearing from our developers in our owner community that they want diversity in the construction workforce. So it really inures to the benefit of union construction to make sure that they are recruiting and retaining that diverse workforce. We have developed what's called Finishing the Job, which is a manual of best practices for all stakeholders in the industry, from the owner to the construction managers, to the subs, to the unions, to the apprenticeship programs, about how to make sure we're achieving and retaining diverse workers. And in terms of the contractor piece, we want you to make sure that you're training your chief staff, your foremen, your supervisors, and so forth in those best practices, that you're making sure that your foremen implement these best practices, not only in terms of giving, you know, overtime opportunities, for example, to women and diverse workers, that they're well schooled in what it takes to retain that diverse workforce. Use toolbox talks to reinforce the message that everybody is welcome on the job site and that the diverse skills and qualities they bring to the workforce are actually beneficial to the industry. And then closely monitor, as I mentioned before, overtime. We noticed on the Encore Casino project in Boston that women were not getting the overtime opportunities that the men were getting, and that was corrected. So again, it's all about making sure that we're not only creating a diverse pipeline, but that we're doing everything we can to make sure they're retained. To Ariane's point, we're investing all of this money in diverse workers. We want to make sure that they stay with us forever. The other thing we would recommend to contractors is, they have a part to play in hiring diverse workers, but on the recruitment side, it's the apprenticeship programs. So really demand of your apprenticeship programs that they're bringing in a diverse applicant pool. And that means not putting an ad in the local paper, telling people that you're accepting applications, but really doing broad-based intentional recruitment in communities of color, with women's groups, all of those places where that you will reach underrepresented populations. So I would say to Ariane's point that, we agree that it's important to do this work. You just have to be intentional about it. And in Massachusetts, we are now at 10% women apprentices in union building trades programs across the state. We've increased that percentage since 2012 by almost 30%. We have several of our apprenticeship programs that have reached 20% women apprentices, several that increased that percentage by 20% over the past year. And our goal in 2025 is 25% women apprentices in our union construction trades, whereas the non-union sector hovers around 1% to 2%. So this is a real market opportunity for union construction to increase its market share.
Thank you so much, Mary. That was great. And I think there's no better segue than to toss it over to Lamont Davis, who is a contractor, owner of Anvil Steel Engineering. Lamont, I'd love to hear some of the obstacles that exist out there for contractors to achieve diversity goals and how you overcame those, especially on the Encore project that Mary brought up.
Yes. Once again, my name is Lamont Davis, the owner of Anvil Steel and Engineering. And while I was out on the Encore project, I noticed that diversity was being a big issue that was being pushed there, and there was a group effort. So what I did is I came back to the office and I created for my foreman a checklist. And in my checklist, we went back to all the guys and women that were working for us and apprentices, and I actually had them fill out what their status actually is. Whether you're African-American male, whether you're a female, whether you're a veteran. And we found that we had some apprentices that had veteran statuses because their mother or their father were a disabled veteran, which qualified them to fall in as a veteran. And there was guys that I've worked with that were iron workers for years that I never even knew were veterans until they checked off our paperwork. And then once we were able to come back and review our paperwork, and we made it a 2-part and turn it in, that's where we were able to start having our historical data as to how diverse our company was. So that was one of the things that I implemented while out on the Encore project that helped me for the third quarter between 2018 maintain a rate of 45% minorities, 7% females, and 20% veterans. And that's what we're able to maintain. I think the biggest thing for contractors to know that the future, this is the way that it is. So you might want to have your own historical data as to where you sit and fit within the system. I'm currently a tier 2 contractor. Some of the larger contractors that have problems reaching these goals, I think you should reach out to some of us tier 2 contractors and we can help you succeed in those goals. Whether it's subbing out a smaller portion to a tier 2 helps a tier 1. It's the way of the future. This is the way it's going to be. So it's best to try to pair up with a smaller subcontractor and work with them, whether it's a minority-owned or woman-owned or a veteran-owned business. And you'll generally find that most of us that are smaller have been hands-on for quite some time. So we understand and see how important it is to have a complete all-around workforce.
Thank you very much, Lamont. And now I'd like to toss it over to Vicki O'Leary, General Organizer with the Ironworkers International. So Vicki, once we find and train our diverse workforce, how do we keep them from leaving the workforce? So what are the challenges and strategies to for retention?
So in the spring of 2019, we interviewed a select group of women iron workers across the USA, including apprentices to journeywomen with over 25 years experience. They were welders and rod busters and structural iron workers, white women, women of color, LGBTQ. All the women we interviewed work with the tools. And this is some of the findings that we had. We found that half the women, they felt very supported by their unions, but other half did not. And most frequently, the women ironworkers did not report the abuse that they felt that they dealt with on the job. They generally dealt with it alone. And the ironworker women were reluctant to report any issues, even ones involving worksite safety, due to not wanting to be labeled as a troublemaker, or they were kind of fearful of retaliation. And the women also generally felt that they had to fix themselves. When the women raised issues of discrimination to the union or contractors, the women were often told that they were wrong. Restroom facilities, there was issues with that. They were widespread. And nearly all the women said that their learning the skills was harder for them, not because the skill was that difficult, but because people just assumed because of their gender that they weren't going to be there that long and it wasn't worth teaching. So if they had a mentor, they felt like they could have made more strides in their career. But 100% of all the women that we surveyed said that they wanted brother ironworkers to actively support their sister ironworkers by helping show the ropes, by teaching them. And that was any form of job site training or mentoring. Ariana and Mary said that we're spending $32,000 to train one ironworker to get through their 4-year apprenticeship. We're just not using our training dollars very effectively if we're losing them. What we learned was that most of the women that left the ironworkers didn't do it because the work was too hard. They left because of the harassment and the treatment that they were receiving on the job. Bullying and harassment, they have just this dangerous domino effect because you've got the person that's being harassed on what's coming next. The harasser is focusing on their target, and the witnesses, the people that are working around them, are totally engaged in watching what's going to happen next. Literally what you have then is safety's compromised. You've got a whole group of people that are not concentrating on the work that's on hand. And with ironwork, that focus can have a deadly consequence. Bystanders can help reduce trauma and keep ironworkers safe. And we call it SAFE with the acronym. Stop trivializing harassment and sexualized language and jokes. Avoid victim blaming. And file a report. Let a supervisor or local union leader know what's going on and what you witness. Coworkers are the best resource that we have for getting this to stop. And ensure that the aggressor understands that this bad behavior is not going to be tolerated by their coworkers.
So Vicki, I just wanted to go back to the point with harassment happening on job sites. That impacts not just the person that's being harassed, but it could affect retention of anybody on the job site. Is that correct?
It absolutely could. There's always what we consider the weakest link on the job, whether it's a man or a woman, doesn't really matter. There's always that one person that we as iron workers tend to beat on all day long. And that's the kind of stuff that's got to stop. I mean, good-natured ribbing, I guess that's okay. You just don't want to get into a point where it's illegal harassment, where it's going to not only affect the people that are around you, but affect the contractor's bottom line. We have a whole program of Be That One Guy that if would like to have this training, or if a local union would like to get this training so that their leadership is all on the same page, the apprenticeship's on the same page, we would be happy, Impact would be happy to supply this training. And that's all part of retention because we want to keep those training dollars that we've talked about before. But another way that the iron workers have learned to retain part of our workforce is by having a paid maternity policy. The ironworkers paid maternity provision policy was basically brought out because in 2016 at the Tradeswomen Build Nations conference, we had a caucus with our general president, Eric Dean. And through that, we found that a woman had worked one day too long in the rod patch and ended up having a miscarriage. And when Mr. Dean heard that, he said he felt like he had been sucker punched in the gut. On our way out, he said, we need to figure this out. So I went to work and I found that we had this off the job accident policy, that this is something that we could dovetail off of. So how does this work? They have to have insurance through their hall. They can't use the policy in the past 24 months. So every 2 years you can use this policy. You're going to get 66% of your pay with a cap of $800 per week. And you're going to get this for 6 months prior to giving birth with an additional 6 to 8 weeks after giving birth. We think it's probably one of the best. Well, we were the first, but we're very, very flattered that now other building trades, not only flattered, good God, we need it. The tradeswomen need this. We want to keep them. They shouldn't have to choose between growing their families and work. So now we know that other building trades have done this, and it's really just amazing.
Well, I'd love to hear from Jennifer Hose. You're a journeyman with Ironworkers Local 377, and you use this program. So I'd love to hear your experience with it and how it benefited you and helped keep you in the industry.
Oh, hi. Okay, so I wanted to say thank you for having me talk today. It was a blessing that I got to use the maternity leave. The first part that was really awesome about it was the safety for for me and the child. Like, I worked until I was 5 months pregnant. And then after that, I thought, well, that's probably a good time. I shouldn't be picking up heavy things, climbing ladders, stuff like that. So the maternity leave really helped out with the safety factor of it. Also, the financial part of it, knowing that I can bring in an income and not miss the income on it was really great. And then also, the time off after having the baby, I was able to bond. You get about between 5 and 6 weeks, I think, off. And I was able to bond with the baby and, be able to figure things out before I went back to work. It was pretty good. And I had a really good time with it. It was very helpful. And I think it will help out a lot in the future with other women, because like Vicki said, there was a lady that did have a miscarriage. And I know of other women that were pregnant that just quit because they were worried about, hurting their child and the income and everything like that. So it really will help in the future, and it'll help women stay in the trade, I believe. I'm very grateful that our union was the first to put that together, and I see other trades are coming in now and doing that, and that's awesome.
And Scott, I do have to tell you that we have an 83% retention rate with the women that have used the policy. That tells you right there, they're coming back to work once they've had their baby. So I can't tell you enough how great that I think this policy is, and the help that we've had for our members. And Ariane, you actually did a study on this, didn't you?
Yes, and it's really exciting to see how it has come out. And I know, there are always these concerns. Everybody is suddenly going to have a baby, and we have to limit it because otherwise they're going to have 10 babies, and it's going to bankrupt the union, which of course hasn't happened. And what was interesting also, talking to other unions who've followed since, it came up because women said, we cannot, okay, you tell us, go out, recruit your friends, tell other women. And they said, well, they can't imagine how you can be a woman and a mother in the trade. So don't even look at the trades. Having the policy, I think, has sent huge signals.
That's great. So, Ariane, I'll throw this question to you first, and then anybody else can feel free to chime in. But, I know we can look at raw numbers of how many women, people of color, and other disadvantaged groups are in the construction industry. But are there any other ways we can measure the success for diversity and inclusion?
I think the best examples measurement, I do think basic measurement is really important. Not least because we know what gets measured can at least raise to the surface of getting, into our minds, which means enforcement, and it means also proactively helping people when they don't meet targets. And I think the work that Mary has talked about in Boston and Massachusetts and in some of the other areas, holding contractors and developers accountable but with technical advice, not just saying, oh, you know, you're wrong, you're out, and you get penalized, saying, okay, we realized something didn't happen here. Let us give you some tips of how you may fix it. And I think a second aspect is what monitoring also does is show, okay, why does this foreman why does he not have a problem? And why does this one have a problem, right? What are they doing differently? What can we learn? But we can also say, okay, you say it's impossible. I can't find a woman, or I can't find a black welder or somebody working here, or I'm losing, you know, the other issue is always, oh yeah, we've lost all the women we know because they want to have kids, right? As Vicky said, very often it's because they're being treated poorly. So monitoring does matter, and I think the basic monitoring. The other issue is to have, if you can, to have staff surveys such as Vicky did with the ironwork, so that you get people's unvarnished opinion, and you can track whether there's progress over time in the way people feel integrated in the industry.
Well, I think for me and Jen, being women ironworkers out at one time, I was out in the field by seeing other women on the job, which seems to happen a little more commonly today than what it did when I first started. There were no other women. So Jen, do you notice that you see more women on the job than you used to?
I definitely notice. When I first started out, I could count on both hands how many women were in my local. And now I think, wow, we have probably over 50. And our local is really good in that sense. We try to keep together and network together and get to know each other. I mean, there's a few that I haven't met yet, but yeah, it's gotten a lot more women in the trade, and it's awesome. It's an awesome feeling. So I can't, I can't imagine if I was from a different local that didn't have other women, you know, or as many as we do. Even with the women when I first got in, that was a lot compared to some of the locals that are now, you know, 9, 10 women. That's a lot for some of the Midwest. And so I'm lucky that I'm out of San Francisco local.
Lamont, I wanted to ask you, you know, as a business owner, subcontractors often have really tight margins that they're operating on. When something bad happens like COVID that we've just experienced or are still experiencing, or an economic downturn like the Great Recession, or, you know, some kind of crisis like a natural disaster or whatever, I'm just curious, how do you still look at meeting diversity and inclusion goals while staying, you know, while trying to keep your business alive? Like, how can those two things go together?
Well, from a contractor's point of view, I mean, I think COVID has affected all of us. So what we've done up here in New England is a lot of the larger contractors have actually come out to some of the smaller guys for manpower, and we've put ourselves together in whatever projects are now currently working, whether it was my project or Daniel Maher's project or Prime Steel's project or Suffolk project. We've been promoting helping one another to get through this time of need. Because there are some people with the pandemic who've actually just chosen to stay home, and rightfully so. But there are some of us out here that are choosing to continue to work and, you know, and try to be successful to maintain ourselves. So I've found that some of the larger tier contractors have actually reached out and said, hey, you have manpower. Can you help me here? Can you help me there? And I've been able to sub myself out that way there until my projects pick back up and things of that nature there. So, I mean, from a contracting standpoint, I know we're competitors and we're going against each other, but in a time like this, we need to band together and help each other out as much as possible. That's what I've been finding has been going on in the industry.
And Ariane, you just recently released a study focusing on New Orleans and the tradeswomen and other skilled workers on the opportunities that can arise out of a crisis such as COVID or hurricanes, and you know, how to boost diversity through that. Can you talk a little bit about that study?
Yeah, thank you. What we were trying to highlight, as I said, my institute, the Institute for Women's Policy Research, we are concerned with ensuring that women have economic security, and one of the reasons they don't is because too many of us work in low wage sectors that are now impacted, particularly by the pandemic. But the construction sector has also been hit, but not hit as badly, and is expected to come back pretty strongly, particularly if there are investments in infrastructure, as we hope there will be. And as I said, there's the recruitment issue. So there are jobs, possible jobs open or will open that can take some of the people who now have to find new jobs and should in any case get access to better jobs. So women who lost their jobs in hospitality or in the service sector. And one of the big issues that Mary alluded to is, there's awareness among policymakers that something needs to change. And a lot of women don't see themselves in those occupations. So what we feel is that awareness now pushes policymakers to tell community colleges, to encourage employers, to work with schools, to get more outreach, to say, okay, these are possible careers for women. Because what I thought was really interesting, I talked to one young woman there who was a fifth-year apprentice electrician, but she said the biggest recruitment method for her, and she's recruited others to her local, is she goes after work into a supermarket dressed in her gear, and the women say, hey, what are you doing? And how can I get into that? Which is great that works, but really it shouldn't rely on word of mouth like that. So,
Mary, recruiting a more diverse workforce can often mean reaching out to people that have different needs as far as schedule. They might be caring for an extended family, or have requirements for flexible work hours because of kids or what have you. How can contractors still maintain their project schedules and profitability while drawing on this wider pool of workers that need that flexibility?
Well, this industry is, 6 a.m., 7 a.m. start time. So that does make it challenging for particularly single-headed households with children. And in Boston, we've just launched this Care That Works initiative, which is an initiative that is matching family daycare providers that are willing to provide early hour care with our tradesmen and women, so that they're willing to open up their childcare facility as early as 5 a.m. or 5:30 a.m. so that our tradespeople have that flexibility. And in fact, the first person that we placed in that program was an IBEW apprentice, single father, who had a 5-year-old and needed, before school care. So, that's certainly one option. In terms of the flexible schedules, we always hear that everybody has to be there at the same time. It's a teamwork industry. Somebody's late, comes in later, it throws the whole schedule off. And there have been examples of sites where contractors have provided flexible schedules. So I think it's at least worth looking at that, exploring that as a possibility and piloting it, because as we want to bring more women into this industry, we are going to have to look at how we, crush those barriers for their both entrance and retention in the industry. And again, that example of the IBEW apprentice was a male. So this affects everybody who is, dealing with childcare, especially during COVID. I mean, COVID has impacted women more than men, clearly. And I've heard many examples of women who have had to take time off from their job in the construction industry for childcare. They're homeschooling their children. So we have to make sure that we're not losing these women when they're able to get back, when kids are able to get back into school and women are able to get back to work. We have to make sure that the contractors are providing them an opportunity to get back in that work site.
Lamont or Jennifer, do you have anything to add from the field perspective? Any personal experiences with this?
I can say something about this. I
Sure.
think with that sounds really good with the whole getting the daycare to open up and maybe getting some kind of thing where you can have it, because a lot of people that, especially where I'm from in the Bay, they travel like 2 hours to get to where they're working. And so if you have to drop off your child, and you don't have family or friends that can help you, and you've got to go to a daycare, then that daycare has to be open like at 4 a.m, 5 a.m to get to work at 6 or 7. So, that's helping families, not just women, but it's helping everybody. If they could do something like that, would be really good.
That's a great point. Lamont?
Yeah, from an owner's perspective, I mean, I'm pretty hands-on. I was a pre-apprentice, journeyman iron worker, general foreman. I've worked my way up through the ranks. And I think a lot of it has to do with knowing your staff and who you have and working within the dynamics while getting the goal done at the end of the day. If there's an opportunity for a set group of people to start at 7, then those set group of people can start at 7, whether it's 4 or whatever else it may be. But I really think it boils down to across the board communication amongst the apprentice, the foreman, all the way up to the owner, so we can get a grasp of what's going to work so I can please my client, so I can get the next job. So it's just a matter of me being able to look at the situation at hand and do what's best for all of us. Now, it's not always going to work out in favor for everybody. That's just the way it is sometimes. But let's try to at least be open-minded enough to say, okay, you 3 or 4 are going to be able to start at this time. You guys are going to start at this time, and just keep the project flowing. That's how I handle it. I'm very hands-on, and I talk and I listen to what people are saying. Hey, can we do this? Can we do that? And it generally works out for the most part. But it's not always going to be that way. But we, just be open-minded to it. That's how I govern it.
If I could just, from the research perspective, add something, and again, I think that it's a great example, because what we know from workplaces which are successful in having alternative work schedules and flexibility is to involve the people who need the flexibility. Ask them to figure something out, right? Don't think you have to plan it all. Very often, they can see, okay, maybe we two can work together at this time and still get the work done. So I think in this industry, there's a lot to go in terms of creativity and, innovation in terms of work patterns. We're kind of a little stuck with saying everybody has to be there at the same time and then stay 12 hours type of thing, right? And I think there's scope for trying to see whether there are alternative ways of organizing things.
Well, and we have, so many more technology tools at our disposal now, both from remote collaboration tools like the one we're in right now, Zoom, but also, 4D scheduling on the job site, and, using different methods to make it a little easier to have variable work hours. So Mary, you alluded a minute ago to this, and I wanted to expand on it a little bit, comparing using incentives to boost diversity and inclusion versus, more punitive action. Is there a place for both strategies in this? And wanted to see if Mary or anybody else had any further thoughts on that.
Well, I think there is room for both, but here in Massachusetts, we really focus in on educating the construction community and the owner community rather than being punitive. Under our state laws and under our City of Boston ordinance, it's called the Boston Jobs Residency Policy. There are provisions to sanction, withhold payment and so forth, but they're rarely implemented. And, some activists are really pushing the city to do this, but our point of view has always been that it's better to educate and assist contractors with that technical assistance that will help them achieve the goal, because that's ultimately the end game, is to get the diversity and to work with the contractors. On the Encore Casino project that Lamont was on, Encore actually provided incentives. They provided awards to contractors that either were doing great from the very beginning or made a lot of improvement in terms of their workforce participation goals. And they sent them to Las Vegas, to their casino there. So I think that, Lamont, you may be familiar with that program. that might have provided some incentive for improvement on that particular project. And that project did meet and exceed its goals for both women and people of color. But part of that was that we have what's called an Access and Opportunity Committee. So that was a committee that met monthly. It was a public meeting. The Mass Gaming Commission was always present. The owner of the project was present, as well as community advocates, contractors, community-based organizations. And it was at those meetings. In the beginning, it was he said, she said. It was very contentious, but then it evolved to a place where, again, we were educating and sharing best practices about how to meet these goals. And that laid the groundwork for, finishing the job best practices and the other things that we're doing in Massachusetts to achieve workforce diversity and inclusivity.
Vicki, in the field, how do you get people to be that one guy without knocking heads together at the job site? What works?
I truly believe that 90 to 95% are really good guys. It's that 5 to 10% that we are allowing to have too much power on a job site. So what we have to do is educate our brothers that are already our allies to speak up. There's ways of doing it. You can distract. You could say, hey, how was that game last night? Or you can be direct and say, hey, knock it off. But I think what we're seeing is that we need allies to stand with us and by us. And I think that's probably the most important thing.
So Jennifer, I was wondering if you could expand on what Vicki was talking about earlier, the safety implications of harassment on the job site and all of the issues related to having a job site that is inclusive.
I can say, just like Vicki was saying earlier, the be that one guy that could help out. I mean, if somebody's being harassed or bullied, and that's going to be on their mind when they're trying to work, and it's going to be on everybody else's mind that was around it. And if your head's not in the game when you're trying to do your job, that's not safe. So, if the Be That One Guy is a really good program, because, if you say that you want them to stop doing whatever they're doing to make people uncomfortable, then other people should join in. And I know from experience that people do that, so the safety part of it, if people didn't have those issues, then people could, more concentrate on their work.
Ariane, you had included in your report that project owners, whether they're public entities or private developers, are demanding that project teams and workforce working on their projects represents the diversity of their user groups and constituents. So I'm just curious, what role the owner and developer plays in pushing the industry forward.
Can I pass that question to Mary? I think Mary
Sure.
is probably best.
Scott, that's a great question. And I was just thinking about this as you were asking the question. In Massachusetts, in Boston, with the building trades, our developers are now coming to the building trades and saying, you got to give us diversity. I mean, they're requiring it. And what we've done recently is built certain provisions into our project labor agreements around mandatory diversity training on site. We have a provision now for ombud services. So that would be a third neutral party that would help a worker who is aggrieved of discrimination and harassment, bullying on the job. They would help them navigate the resources available to resolve that incident or situation. We're looking at access and opportunity committees on private projects now, not just they have been on the public projects, but now bringing them to private, particularly large scale projects. So again, the building trades, they are using this as a market share strategy because the developers are requiring it. They're asking for it. They're getting the community. If they want their community to support the projects through the, that permitting and development process, that's what they're looking for. And so it is working well for us. And I think it will, we have to take advantage of this moment that we're in and address racism and gender discrimination. And hopefully it's not just a moment, that this will be a culture change in the industry where we're creating better diversity, both in the supply and the demand and the retention areas. So I'm very hopeful. I've been working with the building trades for 35 years, and I've never seen this much change over a short period of time. Although it's like safety. Safety was a culture change. When I started in this industry that long ago, and I focused on worker safety and health, we had a lot of progress to make, and we made that progress. And so I always analogize this, and it is a safety concern, as everybody has said on this panel, but I analogize it to safety. It's a cultural change. We have to change the hearts and minds. And if we can't change the hearts and minds, we at least have to change the behavior so that everybody feels welcomed on the job site. That's the bottom line. It has to be a respectful workplace for everybody.
Anyone have anything to add?
As a small or mid-sized contractor that I am, I just feel as though it's an importance. If you want to keep females on a job site, I asked some of my other contractors and I challenged them, how many female foremen do you have? How many minority foremen do you have? If you want diversity, I mean, me being an African-American male, sometimes you might feel comfortable talking to someone, quote unquote, of your own race, or they can understand what you're trying to say or relate. Same thing with women, things of that nature there. So sometimes it's just a matter of making sure you have an open line of communication and just be open-minded as to every walk of life. A lot of the women don't feel comfortable coming to a guy and asking us a simple question, but she may feel comfortable going to another female foreman and saying, how do you put this thing together? So you just have to just pair everybody up and we can possibly work all this out. I know in the beginning of my early career, I felt a little awkward talking to some people, and it was just because of the dynamics of he didn't know me and I didn't know him. And I spoke a little faster than he spoke. And, so sometimes you get labeled as you don't know what you're talking about. And it's not that I don't know what I'm talking about. We're just from different sides of the block. But if we come together, you know what I'm saying, we got the job done at the end of the day. So I just feel as though sometimes it's just a reflection of, women feel comfortable sometimes just going to another woman, or just like sometimes men feel like comfortable going talking with another man. So I think that can help out as well.
Can I just interject, Scott? Lamont made a point about going to a woman foreman or a person of color who is a foreman. And that's the other piece of work we have to do to make sure we're retaining a diverse workforce. And that is providing those leadership opportunities, both on the job site and within our unions, to make sure that women and people of color are well represented and have the same opportunities, the white men have had in this industry for forever. We have to not only, just open those opportunities up, but really nurture our membership so they can take advantage of them.
I just want to follow up, Mary, with me. I feel as though all that's going to be based on one's merit. Like whether you're a woman, it's just on your merit. As long as you can do the job, whether you're male or female, black, white, yellow, or green, with Anvil, you'll get that position based on your merit. So that's my approach. That's the way I look at it. That's how I feel about it.
We've talked about some of the supports that people who have kids or caregiving responsibility need, such as childcare or paid leave. And some of the work that progressive employers and developers do is to be the voice for those type of policies towards the federal government and towards the local government, and saying, okay, we cannot do it all on our own. We know COVID has destroyed a lot of home-based daycare. Do something to support it, and make sure that the people who provide that have good wages, and then we can use that and we can retain our staff, right? So some of, childcare is genuinely complicated, and employers can do things around childcare, but it needs federal government, public sector, it needs other supports. And having the construction industry out there as a voice saying we need paid family leave, we need better childcare will also really help everybody. And it sends a message to say that it matters to the trades, right? It's also good public relations, but it will also help change the industry and who can and cannot work in it.
So in order to know if you're meeting diversity and inclusion goals, as Lamont alluded to earlier with veterans, you have to know who you have that meets those goals. If I got a survey though from my employee asking if I was, say, part of the LGBTQ community, I might give me pause to answer that exactly, honestly. And I'm sure others have that experience from other groups. So how do you track the data, gather the data about your workforce without appearing threatening, I guess?
I told you guys earlier in the beginning that I basically made an employee information worksheet, and that basically on that worksheet, you list your emergency contacts, and you turn it in when you turn in your W-4s to us. It's private, and it says a disclaimer on there that, this isn't going to be used against you for a position or whatever else it may be. And also just getting a report back from some of the guys on the ground or some of the women on the ground and asking, what's this guy do? Is this called, so-and-so's a veteran, or this person is that, the talk, you have to talk about it, talk about it. And like I said, we've just created a worksheet that is a very simple check off, yes, no, yes, no. And from there, we were able to put our numbers together.
Well, we've had an amazing collection of ideas and thoughts about diversity and inclusion. What is the most important message to leave our audience with? What call to action do you have for everyone listening?
Intentionality. This work is not going to be done unless you do it with intention. So that applies to the pipeline, and it applies to making sure that people are employed and retained in the industry on the end of that pipeline. It's not just going to happen. We have to do it with intention and really roll up our sleeves and do the work. That's what I would say.
And I would say that, we've looked at why diversity pays. And I think you've heard a lot of things today. And I think hearing from Lamont about how he not only met his goals, but exceeded his goals, diversity does pay. And we've got a whole lot of people that want to go to work for the ironworkers, and we've got to quit treating it like a country club and start letting some people in that doesn't look like us. If we recall our oath that we took when we became journeymen, about 2/3 of the way down, it says, I will at all times be respectful in word and action to every woman, and be considerate to the widow and orphan, the weak and defenseless, and that I will not knowingly wrong a member of this union or see one wronged if it's in my power to prevent the same. I want you to remember that oath, because I do. Every single day that I talk to our members, I remember the oath that I took. And with that, I want to thank everybody that's on this panel, and I appreciate having a voice today. Thank you so much.
Thank you so much, Vicki and Ariane, Mary, Lamont, Jennifer. Again, I can't thank you enough for all the incredible insights that you've given all of us and food for thought. So thank you.
Everything we do is either directly or indirectly geared towards our contractors and the ironworkers working together to gain more market share. It's just that simple. And all these videos that we have, almost all of them are stored on our website, are geared to educate you, the user of our services, on how our programs work. It's better than reading the text, so it's all there. In addition, just as a reminder, this conference will be housed on our website so that you can access it at a future date or just a particular section thereof. If we want to impress anybody as contractors and ironworkers working together in partnership, it's the end user, the owner, General Motors, Pacific Corp, American Electric Power, U.S. Steel, the list goes on and on. We have to impress those people to show them that we have the safest, most productive, most highly skilled workforce, and we can get their job done efficiently. So that tees up our last survey question of the day. Are you or your organization a member of a local owner or end user association? So virtually everywhere around the United States and Canada, there are end user organizations where those owners, those industrial owners typically meet and discuss their issues. Contractors who want to work in their facilities are members. Local union representatives that want to work in those facilities are members and attend those meetings. And I know a number of you are. So as the results compile, you can see here that it's still pouring in. The numbers aren't too bad. 44% say, yes, they're members of a local owner or end user associations. 37 no, and 19 I'm not sure. If you need some direction on a local owner end user organization, please feel free to reach out to myself or your regional director to get that ball rolling. The next person we have teed up is a good friend of ours, Will Sutherland with Williams, who is one of those owners and users. We look very much forward to hearing what Will has to say.
Hello, and thank you for allowing me to speak at the 2021 North American Ironworkers Impact Virtual Conference. While I know we would all be enjoying the conference, rather be enjoying the conference and the events that are around conferences like that, we can't this year. So I really do appreciate your time to listen to the presentation. You know, this is an owner's perspective on scheduling, planning, and collaboration in construction and how we can work with our unions and union members to progress construction. The success of construction benefits the United States' continued development and impacts our families and our communities we live in. The perspective of this presentation is really from recent observations in the last few years, engaging contractors, unions, subcontractors, and owners like myself. Pretty easy agenda to get through today. I will do a safety briefing, an introduction of myself, and then we'll talk about scheduling, planning, and collaboration drivers that are in the construction today. My safety briefing is one that we often hear about when we're talking construction. That's driving safety. You know, we talk about leaving yourself an out and, you know, looking ahead and doing all the right things for driving. But really, if you've noticed during the pandemic, there's been some pretty remarkable negative driving impacts. Traffic stops have declined during pandemic with fewer people driving. I mean, that's pretty obvious. But fatalities have spiked 13.1% from July through September. The NHTSA reports a 22% increase in vehicle speeds. 65% of the drivers tested at trauma centers were under the influence, and that's compared to 50% at the same time pre-pandemic. So a lot more people are using mind-altering drugs or alcohol and getting behind the wheel right now at all times during the day. Red light violations are up with fewer drivers. If any of you have been doing any amount of driving, you will have seen somebody run a blatant red light. And that's one of the most astonishing things that I've witnessed during the pandemic when it comes to driving safety. And the construction industry can't be overstated. We really have the longest commutes of any profession. Our average commute is around 45 to 50 minutes, and it is almost 15 to 20 minutes longer than the closest commute that follows our industry. So how do we stay safe? It's really, you know, there aren't going to be any things here you're not going to already know, but slow down. Getting to the job site safe should be your number one priority in the morning. When you're driving with your family, slow down a little bit. You have time to get to where you're going to go safely. Drive defensively. This has been one of the things that I've kind of been telling I have a 21-year-old driver and my wife, when we were driving around with our younger kids, is really look around, keep your head on a swivel, and really drive more defensively than we ever have. Treat every intersection with caution. When I talked about those red light runnings, When you get up to a green light intersection, please do me a favor, look both ways before you get through. It could be the difference between you being in an accident and not. Keep your mind on driving at hand and the task at hand. You know, we're all dealing with a lot right now, whether it's kids not in school, learning from home, whether it's being away from our families during a pandemic, or just a schedule crunch on a project. Your mind has to be at the driving, and that's the task at hand. We practice that on the work site. We need to practice that when we're behind the wheel. And the obvious one is buckle up. No matter what we're doing, no matter how short a period you're going to be in the car, buckling your seatbelt could be the difference between an altering injury that won't let you work the rest of your career successfully. So a little bit about myself. My name is Will Sutherland. I work for Williams Companies. Williams is one of the premier oil and gas companies focusing on natural gas in the United States. We're executing work with the union and open shops across the United States. I'm a third generation oil and gas construction worker and love my industry and really love construction. Like many of you, the construction industry has provided well for my family and for me. There's ups and downs, and that's a part of all construction, regardless of your industry. But that's why I'm so passionate about progressing construction so we can all benefit, no matter the state of construction we are currently in. Today, we're going to be talking about scheduling, planning, and collaboration, drivers in construction, experienced labor force, retiring, which is that supervisor and foreman knowledge transfer, some technology adoption, whether that be job site technology usage, integration of technology for real-time scheduling and planning, and quality, diversity, and then we're going to talk a little bit about partners in success. So all of you have been well aware of this. We've been talking about it at probably every conference or every meeting that you've been to in the last 5 to 10 years, and that's experienced labor force retiring, the supervisor and foreman, and that knowledge transfer through them. The most critical aspect we see in the labor force is that transfer of knowledge from retiring foreman and supervisor level employees to the next generation. The three main areas we really see affected the most by this are safety, crew management, and best practices in construction. Safety, there used to be a time where a large part of our workforce came from families or friends already in the industry. You know, as I mentioned when I was giving my introduction, is having been a third generation pipeline person, if you will, I knew a lot of what the dangers were on the project before I went out there on day one. And all that safety knowledge and what not to do was there before that new worker showed up, whether it be through their brothers or their sisters. When they were sitting at the dinner table, they heard all the things that could potentially hurt you, or they heard the horror stories of people being hurt, and they took note of that and said, okay, I need to make sure I look out for that first day that I'm on the job. But that really translated to a worker understanding how much an injury to them or their team impacted the project and the company and their family, right? So they understood if somebody got hurt, if it was a knee injury or if it was a back injury, how much that long-term affected their whole sphere of influence around them. Now the foremen and supervisors are responsible for practical job training and basic safety related to that member's job tasks. With a large amount of supervisors retiring and getting ready to retire, new leaders and workers' safety knowledge transfer is paramount. Along with the basic safety of the tasks, the big picture must be understood by new supervisors. And that's where this knowledge transfer of supervision and foreman level. The big picture look is that if a contractor and their workforce aren't safe, companies will look to other safer contractors when it comes to awarding work. The first goal of every day is to get everyone home the same way in the same health they came into work. But the next goal is to excel at safety for the working person, the contractor, and companies to continue build in the environment that we work in today. Crew management, like safety, many people who came to work understood that it took a long hours and dedication to a craft to succeed in construction. Those basic ideas must be taught today when it comes to crews. The idea on how each team member must manage their time, plan out their day, and what tools will be needed to accomplish their tasks aren't common knowledge anymore. We also used to have a longer runway for workers to learn their profession and observe their leaders methodically plan out their tasks for the whole day. It used to be you were with a foreman for a few years, and before you were a supervisor, you may have 10 or 15 years in, and you saw all that planning and the steps needed to get you to have a successful day on a job. But today, crew management has been upfront and vocal about their expectations and plans needed to accomplish today's tasks. You really have to tell your crew exactly where you're going to be throughout the day and what's going to be required for them to accomplish those tasks during the whole day. Like I said, the work isn't planned at the work face as well as it could be, which leads to those inefficiencies. The good news here, though, is crew leaders of today are really taking advantage of sophisticated scheduling, planning tools for their crews. It's that work face leader that's allow the contractor to stay on schedule. They're becoming more tech savvy and leveraging that technology tools available to them to help their crews plan for the all day work and to maximize production on a job site. The more these crew leaders break the tasks down to bite-sized pieces, the more the new workers can achieve smaller goals and continue with the next achievable task. Those smaller tasks leading up to a day of production, and days of production leads up to a schedule that's on time. You're essentially having to break your project down into much smaller, manageable pieces. Some of this also leads into construction best practices, whether it's safety, crew management. It really comes down to transferring knowledge about the best construction practices. The incredible amount of work the group of retiring employees has accomplished is nothing short of amazing. The tips and tricks to construct faster and safer must focus on this great generation to transfer on before the next generation takes up the torch. The next generation has already begun to mold the best practices with the continued development of technology in the workspace. With the foundation of the past and the addition of technology to the future, it'll be the frontline supervisor who can combine both to succeed for the contractor, subcontractor, unions, workers, and companies. The quicker we facilitate both the transfer and the adoption of technology, the sooner we will see the new best practices in construction arise. This adoption of technology is critical for progress in the construction field. Research through the Construction Industry Institute and the Association of Union Constructors shows production has stagnated or slid backwards from the past statistics. So we can make excuses for the flat line of production, but we need to develop these new construction practices to better our profession as leaders. So when you think about how long we've been constructing, the idea that we're not improving on our production moving forward is pretty remarkable. Now that a lot of that has to do with maybe some additional paperwork, additional safety steps that we need to maintain, but we should be able to work that into better construction techniques and better construction practices so we can make those we can progress those schedules and we can progress production. So that leads me to technology adoption. There's a few things under technology adoption. At one time, construction was the largest lagging industry to adopt technology. So we're going to talk about job site technology uses, the integration of technology for real-time scheduling and planning, and quality. The Construction Industry Institute, CII, refer to them a few times because they really have the pulse on how construction progresses as a whole for the United States. They define construction technology as a collection of innovative tools, machinery, modifications, software, etc., used during the project's construction phase that enables advancement in field construction methods, including semi-automated, and automated construction equipment. Technology can aid in safety, scheduling, and quality. And as I've outlined, safety is the main driver for everyone watching this, including owners. If we can use technology to bridge the safety gaps left by experience gaps, why would we not want to progress that opportunity? Job site technology usage. One significant usage of technology is training members on equipment in a classroom environment, either by augmented or virtual reality. There'll still be a need for experienced leadership, though. However, that technology can help bridge the gap we discussed with new employees entering our business and hopefully learning from these safety topics before being on the job site. If you can learn to operate a piece of equipment, or you can learn about the swing radius, you can learn about, how a piece of equipment, what the safety lockouts are on the piece of equipment, what to do when you get out of the seat. All of these things that we might have used to take for granted, or we might not be captured in that knowledge transfer, can be taught in a virtual environment where it doesn't impact employees if they make a mistake. It won't hurt somebody if they make a mistake, and they can learn through it, and they can kind of get the feeling of it before they're on that job site. Wearables are also becoming more and more prevalent in the job site, whether it's PPE embedded with biometrics or geofencing to restrict certain personnel areas. The technology doesn't have to be intrusive. The job site usage of technology aids the foreman and supervisor with day-to-day activities while bringing new members to our construction site and unions. A lot of the PPE embedded biometric is really handy, because if you have somebody that falls, if someone isn't immediately there, seconds really matter in a situation like that. And with some of this wearable PPE, when they fall, it automatically sends an alert out, and the whole job site understands that somebody is in immediate need for attention, and it can be incredibly life-saving technology for them. As owners, one extremely beneficial aspect in recent months is the use of technology to help maintain working bubbles and contract tracing for COVID. Although all of our workers' incredible work, we have seen little impact to our job sites during COVID. Now, I recognize that can't be said for everyone, but it's the leverage of technology to aid in the solution we're looking for. With our geofencing and with the, again, wearable technology, we've had a couple instances where someone came into contact or they were exposed. We were able to easily alert everyone that was around them that they've been exposed or in a contact radius. And we've been able to mitigate that impact to projects, and most importantly, mitigate that impact to personnel, because we can make sure that people aren't getting sick from that contact. We can make sure that people have the right knowledge because of the contact. All of that is paramount to, a company trying to make sure our workers go home every day like they came to work. Being open to new technology for contractors in the workplace will only push that technology adoption more and more on our job sites. It used to be, again, because construction wasn't the fastest adoption of technology, there was a kind of a push away against technology because we thought it might impact jobs, or we thought it might reduce the amount of personnel in a project. And we really haven't seen that. And what we have seen is the safety benefits of it, and the benefits of being able to walk people through our environments in a more meaningful way and plan our work in a more meaningful way. So the integration of technology for real-time scheduling, I wouldn't be a good owner representative here if I didn't give the nod to technology in helping planning and scheduling. With labor shortages and people retiring from the crafts, technology can help this area just like it has in safety. And technology is also a key to a diverse work group as well. Between scanning tools, scanning installations daily, iPads being used to mark off drawings, and VR paired with BIM, all of these technologies allow for accurate scheduling for the project or the crew. The material can be placed in areas for ease of use, on demand based on information being fed to the supply chain, and weekly schedules can become more accurate. The owner and contractor have more active conversations about delays or impacts, and a contractor rep can walk an offsite PM through an augmented view of the site. And what this does is these efficiencies really offset the negative impacts of what we have discussed when it comes to retiring workforce and a knowledge transfer. It's a willingness, though, for members and contractors to leverage that technology type that will progress us. The idea that we're able to have that material given to us when we need it, one of the best technology adoptions I've seen is in the space of hangars for vertical construction. A person has a augmented reality goggle on that is mounted to a hard hat. It's all with a safety glass, ANSI rated safety shield. And they look up and they know exactly what color and what hanger to put in that building. That has been an incredible time saver for that contractor. And it makes the going back and forth, having to look for the right hanger, making sure you have the right hangers in your area to put them in, makes all of that so much easier for the construction workers. Quality, the technology can be used in quality as well. Scanning material before it's installed gives the owner that knowledge of their design specs being followed. A lot of material nowadays has QR codes. You can scan those QR codes, and that gives the owner knowledge that, okay, that right piece of steel is where it needs to be. We don't have to go back and potentially do rework to make sure it is the right and then find out it's the wrong. It also helps contractors catch those mistakes before it becomes costly rework. Again, this isn't all about the owners. If the contractors succeed and less rework it, they become more profitable, which means they can work more jobs. And again, we can employ more union craft labor. We've seen some robots used for pictures on job sites. The use of this technology isn't for a position normally really held. It wouldn't make sense for a skilled craftsman to walk around the job site in circles essentially all day long taking pictures. What those pictures do is it goes off to that offsite management team though, and they're able to look at the progress of the day. It also gives them a historical view of what's been installed in a wall, for instance. So if there's a design change down the road, you can pull up those pictures and know exactly what that design change is going to consist of and how much rework is going to cost. That robot follows a path, takes thousands of pictures all day long to document the project design and the build. Again, that embracing of technology for all of us in construction to increase production and profitability is very important. And I don't want anyone to think that profitability is the ultimate driver, but it does help everyone continue to build and continue to succeed in the United States. I'm not advocating for the use of fewer workers through technology. I'm saying we have an opportunity to maximize how we work with technology so we can keep wages up and keep constructing projects continuing to build. Again, when we talk about the flat line and productivity, using technology to make that productivity goes up only helps all of us. The next thing I'm going to talk a little bit about is diversity. I know some people think this is a bit of a squishy topic, but diversity is something that all owners are working on. It's becoming a positive part of all of our owners' culture. I also believe it's becoming a positive part of contractor and unions cultures. There's a lot of work to do in this space around diversity and inclusion, but we as owners are most impressed with the unions and how they've handled D&I. We really think unions are some of the first work groups to see the benefits discussed that I'm going to talk about here in a second. Diversity adds to our talent pool. It drives innovation and growth. It helps with that better productivity, and teams are more engaged and happier. You know, adding to our talent pool is really the biggest advantage of diversity. When I was talking about technology, a lot of people really want to see that technology and they get excited by that technology and will enter the workspace because of it. It's increasing our talent pool and bringing in new people to a fantastic middle-class lifestyle is what we're all trying to do. The opportunities for high-paying skilled jobs are being seen by more and more people as a path to financial success. Recently, there's been small shifts in craft labor being a more substantial alternative path than traditional degrees and jobs as well. To continue that message and growth, we have to have diverse work groups working with us on our job sites. Those added numbers being attracted to the work will lessen the shortage of craft labor. And according to the Craft Labor Supply Study for 2019, 50% of our organizations are still struggling with a small craft labor shortage. So the more diversity, inclusion, and adding to our talent pool, the better off it is for the unions, the better off it is for the construction companies, subcontractors, and owners. It also drives innovation and growth. When a team is comprised of a diverse group of workers, it drives critical thinking and problem solutions that may not have been there before. I've recognized this in my own teams, and sometimes I look at a person, they'll bring me a new idea, and I'll be like, I've never thought of it in that fashion, or I've never thought of it to that kind of construct. These differing perspectives sometimes lead to ideas and growth we haven't imagined before. And they also highlight areas that could be a limitation to some groups. One example is that the U.S. Navy recently highlighted an example of this, and they've designed a new G suit for female fighter pilots. You know, this keeps them at their peak performance while in combat. And again, it was something that was observed that was a limiting factor for those female fighter pilots in combat, and they've solved that problem through the use of technology, understanding a diverse platform, and understanding the people that are working for them. Better productivity. Gallup reports that removing bias from the interview and hiring process and hiring based on skills and talents leads to a 41% less absenteeism, 70% fewer safety incidents, and 59% less turnover. These types of results are in every research article, when you read them throughout the internet and research publications. Whether it's specific to construction or corporations, it doesn't matter. It'll take some new skills by everyone to foster this type of diversity and inclusion. But when everyone gains from it, why would we not want to do this? What site leader can't appreciate a 41% drop in absenteeism and how much that helps their team, how much it helps the morale of their team? All of that is tangible things that we can immediately recognize in the construction space. Also, teams are more engaged and happier. If statistics increase our talent pool, growing companies and innovation, and better productivity don't convince you, we work in an incredibly demanding field. It's comprised of long hours, incredibly hard work, and sometimes being away from your family for long periods of time. The idea that a more diverse workforce will lead to a happier and more engaged team when we are all working side by side is a compelling reason to add that diversity to your team. One of the main reasons that owners and owner clients really enjoy diversity and inclusion into their culture nowadays. So we're partners in success. When we talk about scheduling, planning, and collaboration, retiring workforce, technology adoption, diversity, I hope you come away from this presentation with a viewpoint that owners are working on the same things that union and their members are working on. We want safer projects, better scheduling and planning, collaboration, and that D&I initiative. We have a long way to go in some areas and are better positioned than others. We can't do our work alone, and the more conversations we have with union leaders, union members, and contractors, the more thoughtful the conversation can become. What I want to do is thank you all for the time today, the opportunity to speak with you, and I hope you have a safe and productive day.
All right, great session today. For our ironworker attendees, remember to come back tomorrow morning for the ironworker only session at 10:30 a.m. Eastern Time. It'll be packed with a treasure trove of information from your leadership and your colleagues focused on different aspects of the trade and other informational items. And you can access this session just like you've done today and yesterday through the Attendee Hub by clicking the Join Session button in the event listing. We know it took 6 clicks to get in, and that's part and parcel of the virtual session, but it's just clicking the mouse, so sorry for any travails you encountered there. We'll see you there tomorrow. Thank you for joining this year's virtual conference. And while the venue wasn't what we hoped for, I know we're all walking away from this with some useful information, and we're looking very much forward to seeing you at the Hilton Union Square, February 20th through 23, 2022 in San Francisco, California. It's going to be a packed house. We look forward to seeing you there. Thank you.